Hey, this is a seated hip or glute butterfly, so it's a fairly straightforward looking exercise, but it can do a lot of good in working some of the hip stabilizers. So I'm just coming to a seated position. I'm gonna have a nice upright posture, feet flat on the floor, but I'm not pushing down. From there, I'm gonna get my feet about shoulder width, maybe a little wider than normal chair. Let the band pull me in, and then I'm gonna push out and try and squeeze muscles by my back pocket, and then letting this draw in. So that's kind of the whole exercise. A couple technique points. One is sometimes people feel their knees or their back of their legs or hamstrings if they're either pushing down into the ground and forward, it's almost like I'm trying to push into the ground, or if they're pushing down and pulling backwards. And so the brain and body will do that to try to create stability and work, particularly when you're trying to fire a muscle that maybe you haven't used in a little while. And so I want to keep the feet light on the floor. They don't have to stay flat. Actually, I want them to rotate up a bit. As I come out, that gets hip external rotation, but I don't want to push down because that can fire some of those other muscles. If this is not painful, I want the knees to drop inward. That gets hip internal rotation, which sometimes gives these muscles more room to work. And then I want to come out all the way as far as the band will allow, squeezing, holding for a second, and dropping back in. Sometimes we have to consciously focus and direct our attention to make the muscle work a little bit more than it would normally. Because I can kind of sit here and just do this with my knees and nothing really happens. But if I relax, sit upright, I know I'm working here, and I consciously, you can even feel them, squeeze, 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 hold, squeeze them as tight as you can, let them relax. So I'm consciously squeezing, trying to find engagement, and then coming in, rather than letting the band do everything. I'm trying to direct my attention, and that can help with what we call neuromuscular activation, which is often why I would prescribe this exercise in the first place. We're trying to get the brain to stabilize in a new way. So we want to feel work generally back here, a little bit on the sides of the legs, okay, but don't want it in the knee, or if you have areas of pain, we don't want to feel it there. Some other things just from the side. I know this is a basic exercise, but the details, devil's in the details, as they say. So sometimes as people go, they'll try to do something with their back to get momentum, and so back can be relaxed. I do find a slight lean forward seems to help, but you can play with the torso position and see what feels best for you. And all we're doing, usually like 15 to 25 reps. Sometimes we need to add a second band. I got a lighter blue one down there to really get some fatigue through there. You can also experiment. I don't find that this height of the seat matters a ton, but you can play around with sitting a little lower or sitting a little higher. So often I'll use this as an introductory exercise to get the feeling of work here, and then I would progress it. And so I can't emphasize enough, as you're doing this, don't just kind of wave through and go through the motions. Try and mentally connect your brain to that area, so that way as we go to maybe jump to a single leg or an exercise in standing or something that will carry over to running, our brain can more easily call on this. I'm consciously squeezing it, almost like I can squeeze my fist light or tight, and there's no change in the resistance. So if we know what we're working, we can get resistance or get a muscle burn, even at a light resistance level, if I really squeeze. And so as you go through this one, try to give that a shot, and then we go till you feel a little bit of a muscle burn.